Yeah, okay, it's time to start. Sawyer County Health and Human Services Board is now in session. Call to order. Roll call, please.
Dale Schlueter,
Here.
Kay Wilson. Here. Marshall Savitsky.
Here.
Chris Rusk. Bill Trepanier. Don Pettit.
Here.
Carol Pearson.
Here.
Miss Sabrina Dunlap. Here. You have a quorum.
Thank you. Pledge of Allegiance.
Allegiance to the flag of the United States of America. And to the republic which stands
One nation,
nation under God, indivisible, with liberty and justice for all.
This doesn't sound certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay. Public comments. Do we have anybody? Nobody signed up? Okay. Approval of last month's meeting.
motion.
I'll make that motion.
Second.
Okay, motion's made and seconded. Any concerns? Okay, everybody in favor say aye.
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 Motion passed. Okay, where are we here? Committee reports is Brian? Bill there. Is our,
Present.
is it our liaison? Oh, okay, yes, thank you. Sorry, Phil. Bill, did you have a report?
I'm sorry.
Do you have anything you want to?
Oh, no, I mean, are we talking, are we at me right now? Are we just taking roll?
No, we're at Postal Liaison Report.
Okay. All right. Thanks, everyone. Tonight I have Dr. Harry Malcolm here to give an update for the tribe. Can you do that, Dr. Malcolm? Thank you.
Hello, thank you for allowing me to be here. Last time I spoke, I'm trying to remember exactly what I talked about then. The issue that we've had in December has been some of the RSV, which is respiratory syncytial virus, and COVID, and a little bit of influenza. We actually had a pretty big outbreak in both the daycare and the Head Start program out on the reservation. We actually had to close both those facilities, which posed a problem because a lot of people then couldn't come to work because they had to stay home with their kids. I think at one day I had one nurse in the clinic for 5 providers, which was, it may not mean a lot to you, but it's hard to run a clinic when you have quintuple the providers and to the nursing staff. RSV, respiratory syncytial virus, I think I talked about that a little last time, but it is a pretty serious issue for children, especially under 9 months of age. I think we ended up with 3 kids up in the ICU up in Duluth with that. All of them did well in the end. With the Christmas break, kids out of school, places shut down for a couple of days. We've been doing better. We did, I think I've only had 1 positive RSV this week and 1 last week, whereas the last couple of weeks in December, we were having a lot of respiratory syncytial virus. So hopefully that's done for the winter, though it certainly could rear its ugly head again. COVID, we're still seeing a fair bit of that. I had 8 positives yesterday, just 2 today. Again, it's not as serious as it was 2019, 2020, though we're still having upwards of 1,000 deaths a day in the country from COVID globally. Though locally, I don't know of any. I know the hospital's been very busy. Dr. Dunlap's here. She probably can comment on that. And a lot of that's respiratory virus driven, I believe, from my discussions. I'm sorry. Okay. So, but I gather the hospital is actually fairly full, both with adults, mostly with adults with a respiratory-related virus. It's that time of year, and it's going to be a moderately difficult year. Hopefully, things are quieting down a little on the outpatient basis, but it sounds like inpatient at the hospital is still pretty busy. Do you want to take any questions? We haven't seen much influenza yet here that I've seen. I don't know about. I know the hospital and the ER seen a little bit. That could be coming still down the road. I know our vaccination levels aren't super high, so that worries me just a little bit. But we'll have to see what comes in the next couple weeks. Typically, I've been a doc in the community since 1995. I see a little lull usually coming, and then I see a spike after Berkey when people come here and spend their money and enjoy the race, but also bring their viruses to share with us. So we'll have to see what comes in late February, early March. Everyone take any questions if there are any questions.
Chairman, I got a question for him. Dr. Malcolm, is there a treatment therapy or something for high-risk elders that contract COVID that they can initiate immediately to help their response to it?
Yes, there is, and Dr. Dunlap certainly could talk to this too. There's the therapies have varied as different strains have evolved. Currently, there's a medicine called Paxlovid. It's an oral pill. It's 2 or 3 pills twice a day for 5 days. It can significantly decrease the risk of hospitalization, the risk of death, and shorten the course and the symptoms that people get. I actually had a personal experience with this. I've had COVID twice. That's what happens when you see 10 people a day with COVID and do 10 nasal swabs a day. The second time I got fairly sick, and mind you, I've been a doctor for almost 40 years, and until I had COVID second time, I never missed a day of work ever, including working 7 days a week a lot. And I got fairly sick the second time with COVID. When I started Paxlovid, by the second day, I felt a fair bit better. Now, is it just coincident, or is it Paxlovid? So I was impressed. It can give you a pretty bad taste in your mouth, but there is a treatment for it. It is in a little bit short supply. So like the patient I saw today that I diagnosed with COVID, I had to call 3 pharmacies before I could find a pharmacy with it for them. So, but there's meds out there for that if, for higher risk people. This is someone that had emphysema and was on oxygen, so I really felt that she needed it. Any other questions at all? And Dr. Dunlap, do you have any other comments about this topic? Okay. Thank you for your time.
Doctor.
Yes, sir.
Just curious, the 3 that you sent up to Duluth intensive hour,
Yeah, what I've heard is all 3 are okay.
Oh, okay.
And they actually, they're mostly going from our hospital emergency room. There was 1 child we sent from our clinic to the hospital that went from the hospital to Duluth. The other 2 came directly into the emergency room in the hospital and then went up north. But I believe all 3 have done well. And I've been pretty impressed with how significantly ill a 6-month-old or a 3-month-old can get with RSV. For us, it's a nuisance. But for them, especially under 6 months of age, it could be pretty significant. Oh, that's right. Last time I did comment, there is a monoclonal antibody treatment because Dr. Dunlap, I remember you talked about that a little bit too. We're struggling to get it. It's in short supply. It's something that we can give to prophylax or prevent this from happening to children. It's relatively new. I'm hoping next year we have a bigger supply so we can talk to parents of young families that we can give this to their 2-month-old, 3-month-old young child during the winter season so they don't, if they were to contract this, they don't get that sick with it. It gives them immunity to it. So that's coming. So hopefully next year will be a easier RSV year. Yes. What Dr. Dunlap's talking about is giving the vaccine to women near delivery. They make the antibody, and the child then has the antibody from the mom. So giving it at the end of pregnancy, and that is a legitimate treatment option to be given in the last 4 to 8 weeks of pregnancy. So that's available now too, plus directly given this monoclonal antibody, which is an IM shot, just like them getting a measles vaccine. It's not an IV or anything like that. So that's going to be a significant help in future years when we have a better supply of it.
Okay.
Any other questions? I'm sorry to take so much of your time. I know you got a long meeting. Thank you.
No, thank you.
you.
Thank you for your time.
I'm sorry to run. I have another engagement.
Yeah. Lynn?
Yeah, Chris Russ just joined the meeting virtually. And just a reminder for everybody here to use your mics, even if for those short spurts, since they can't hear online.
Is mine on?
Yes.
Yeah, okay. Senior Resource Center, do we have anything from them? Oh, okay.
Yeah, I don't have anything to add other than the report that Joey sent. We're still looking for cooks in the Stone Lake facility, both the head cook and the assistant cook, and the fundraising efforts are ongoing, and they've been picked up another night of bingo, so hopefully that will help a little bit as well.
Jim, anything you wanted to say?
Yeah, just add, this has been discussed at a couple other meetings, but the county did advance $10,000 to Senior Resource Center to cover the Meals on Wheels driver reimbursements. They were waiting for their funds from October and November last month, so we did advance. We allocate funding to them, so we do have a kind of a safety mechanism there to make sure we get the money back.
Thank you. Anybody online want to? Okay. Administration, Gloria?
The only update I have is that we will be having our all staff meeting on the 24th of this month. Otherwise, no further updates from admin unless Andy has anything. Okay, whoops, I brought up the wrong report. I was out sick at the end of the month when we were supposed to be getting some of the reports put in here. So I have a couple that I'm just going to pull up on screen that I have received. And I don't know if Carol is on. Is Carol on? Okay. So some of the things from the adult long-term care unit, they've received 19 referrals in December and 34 walk-ins. Their email, their ADRC newsletter for dementia care specialists was emailed out to 289 people. 129 are specifically through Sawyer County. They'll be having Powerful Tools for Caregivers, which is a 90-minute class. That's going to be held January 17th through February 21st. And we can make sure we get that link into the minutes. And that will also be, can be emailed out. Our benefit specialists, our elder benefit specialists, saw 22 Medicare recipients. And those are ages 60 and older to be assisted with Medicare's open enrollment period. Oh, I can go, let me slide down a little bit. That's a big report there. Okay, and there's the benefit specialists and adult protective services. We have 83 open investigations from January until December. 30 of those cases are for financial exploitation. And then we have some mandated court reports that we need to do, which are called WATS, and we have 39 reviews for 25 report, and 25 of those live outside of Sawyer County, but they are still wards that we need to do those annual reviews on. So we have contracted for additional services to help us get through those reports, and things are moving pretty smoothly with that process. And again, I already talked about the Powerful Tools for Caregivers. And I think this one was already, that was December, which is right here. And that's Wednesdays, 3 to 4:30 p.m. And you can call the ADRC for additional information for signing up for those classes. Any questions?
Don't see any.
Okay. We'll go ahead and move on then to, I believe I saw Alicia on.
I'm on.
Alicia, your report is fairly similar to last month, but I just pulled it up on the screen now. Any updates? I know we did have that review.
Yeah, we had our CCS review. We did well with that. We just had one area that we had to remediate, which was very minor. It was just one form, which in the big scheme of things for 4 counties, I think that was excellent. We also had our CLTS review, and we got the results back last week, and there's a few remediation areas that we have to do, but we did quite well overall. So once we get, they made a couple errors themselves, and that's what that whole process is for. So it's more of a checks and balances to make sure what they said they had or they didn't have. We go through this back and forth. It takes about a month to get everything cleared out, but we did really good. So that's another positive for that program, especially with the amount of work and the amount of clients that's on there. Ruth Ann and Terry did a great job with that review. The grant for CST was approved for 2024. So that was another plus for the department. So everything, all that work, November and December, it all paid off. Everything went very well. I'm very proud of everybody that was involved in getting everything done on time, and the reviews went very well. So I'm very pleased with everybody. They all did a great job.
Thank you, Alicia. Anybody have
Sure.
any further questions?
Don't see any.
We do have the monthly mental health monthly expense report in here as well. And we are targeting within budget for that. I don't know if there's anything further you want to add tonight, Joe?
I would just say.
Sorry.
I would just say that we have 6 people in transitions, 6 of the 8 beds, and one of the beds is being filled by a resident from another county that we've marketed the bed to. It's my goal to try to get someone there from another county. But this is from Ashland County, but marketing to Ashland, Bayfield, Price, and Iron to try to utilize the service.
Good.
Thank you.
Thanks,
you.
Joe. Okay. Okay. You want me to just keep moving right along, right? Okay. So Child
take your
Protective
time, yeah.
Services and Youth Justice, yeah, this is keep going. Okay, Sarah, you can step on up. I do have, I did notice that in the report for the children in substitute care that some of the numbers didn't pull over fully. And so I quickly pulled together a PowerPoint just to be able to kind of show where we're at. So I'll kind of go through that a little bit, and then Sarah can give any additional updates and go into youth justice as well. Just looking at, we'll look at this is really taking that report that's in there, and we split it out by foster care, treatment foster care, residential care. The other thing that we'll do, Kay had recommended acronyms and probably also a definition even of what each of these means. We'll make sure we get those added. So that's just standard throughout the report. So thank you for that. Anyways, foster care expenses are dropping slightly in 2023. And again, these numbers are through November of 23. So we don't have December in there. Treatment foster care has gone down significantly, and this is more and more intensive foster care that kids are in. Residential care is something that we're kind of looking like we're a little bit up from last year, but what I did want to show you is there has been substantial gains in residential care over the year. So we started out well over 90,000 a month, and now I believe we were, I can't remember, like 26,000 somewhere in there for the month of November. So some of that work that has really been happening starting when we started to get more fully staffed and being able to start looking at placements, being able to make some of these transitions. So that is looking really good for us as we go in to 24. Subsidized guardianship is slightly up, but again, these expenses per month are quite low anyways, and group home is fairly low as well. So we're moving in the right direction when it comes to kids in care, and also been working on some permanency plans, which I can't remember how many there are going on right now, so I'm going to turn over to Sarah. Did anybody have questions on this? Did that kind of help to clarify?
Yeah, I did. Julia, they're moving from residential care to foster care. Is that why that's going down?
Foster care, types of foster care, probably treatment foster care, and then also moving into permanency too. So
Got
it's
it.
all good places for them to be. Okay.
So I would just add that, youth justice in both CPS sides of things have fairly new employees across the board, and really excited to announce that, we are fully staffed and staff are really progressing in their training. And I feel like where we started probably 6 months ago, we've already come really far in making positive progress. Talking about like CPS and what Julia was saying with the residential facilities and being able to go to, it's called like a lesser restrictive placement. So we want to prevent residential facilities. That's typically our last option. We want kids to be in more permanent situations, such as foster homes is generally the best option for us. Sometimes finding those foster homes that are willing to take kids long-term has been an obstacle, not just for Sawyer County right now, but I think counties across the board, it's just been a difficult thing. However, we are in CPS world being able to start moving forward to give these kids more of a sense of permanency and moving forward on court orders, whether that is a termination of parental rights, to do what we need to do to get these kids in a permanent situation.
Well, your youth justice report comes right up here too. So
We will be working on also getting a CPS report to submit along with the youth justice report. We're just still working on kind of revamping that report and what we want in there.
So for youth justice, did you have anything additional you wanted to add? You have a new worker.
I thought I mentioned
you
that
might
last
have.
time. So we do have a new worker, Kim Lambert. She is or was the Hayward High School tribal liaison. So she's really a great addition to our youth justice department. And I know a lot of our kids have been really excited to start to work with her because they already have that positive relationship and knowledge of each other through Hayward High School. So she has really been a great addition.
Yeah.
Yes.
Yep. Go ahead.
May I ask a question?
Yes.
Okay. Sarah, when you speak of children going to permanent planning, how long do the children stay in that in between before they can go to a foster home? I mean, what is the normal? I know there's exceptions, but what is the normal time frame?
We typically try to work with parents for 15 to 22 months before we start considering alternative placements. But we have court orders in place, and if by that 15-month mark, then we start considering what else might be in the child's best interest. But if parents are making attempts and progress. We're not looking for perfection. We're looking for progress. We're willing to keep working with them. It's, when it appears that they're not trying to make any progress at all, that we start looking at other avenues.
Mhm. Okay, thank you.
How are you, Sarah? Chairman?
Yes.
How are you getting along without Oasis now, a place to place these kids? Is that more difficult for you now? I know that we had closed Oasis and didn't really hear the ramifications of that motion.
Interesting that you bring that up because Steve Nagloski, who is the director at Journey Day Treatment, and I were recently talking about Oasis and just what a loss it was for this community. As we do struggle often with finding even a short-term placement or a hold for some of our delinquent juveniles. And I would say that's a huge loss and something that Steve and I long-term goal would like to maybe talk about and look at trying to get that going again.
Okay, Andy?
So I hate to even use the words like exciting, because this is CPS and youth justice, but it's kind of some exciting things happening from the standpoint of where we were a year ago, and 2023 was it didn't start off so great, but I think we've come out of it. Now, the good part is that we've got full staff and things are happening. Not bad, but I had a meeting with the DA last week, and they're seeing more stuff coming over, especially in the youth justice area. At what point, or is there any value for us taking a look at like alternative youth sentencing, like teen court, truancy court, that type of thing, so they're not in the court system, but they're in the alternative area?
Something that I have talked to Julia about and I would really like to start to consider in the near future, and I'm going to be looking into grant writing. I want to start a program that's more so a diversion program for youth in our county, and that is essentially to keep them out of the court system and give them a chance, because once we start putting kids into the court system, research has shown that it can actually fast track them to a more delinquent life. You would think it would have the opposite effect, but it's also, similar to how people used to think scared straight programs work. There's actually no evidence to show that those programs ever worked. And so I think a diversion program would be a great asset to the county and a great option to try to help to, I think the main focus would need to be middle school or younger kids or first offenders in high school, to try to get them different means of help before they get into more trouble. I would love for us to be more involved with truancy. As right now we're not we don't have the capacity to take that on, as we're so heavy with delinquency cases. It would definitely require 1 to 2 more workers to start to take that on.
You want to add something?
Sorry, Chairman. Okay, one more. Is youth justice and delinquencies, is that related to addiction? Or what do you see that's really ramping this up?
Sometimes I think I would say, 95% of our cases have drug-related concerns. And that may not be at the point that they're being referred to us, but upon doing some digging, we start to find, that there's more things going on that are leading up to their delinquent behaviors. Something else that I've noticed in Sawyer County, I've worked in other counties where, we have this assessment tool called the Yazi, and it gives us an idea of if the kids we're working with are low, moderate, or high risk kids, and that is how likely are they to reoffend. And something that I've found pretty astonishing working in Sawyer County is we don't have many low risk kids. There's a lot of moderate to high. And so something that I would like to do in corporation with talking about this diversion program is Julie and I have been talking with this individual, Brian Wright, who basically has this curriculum of work that you can do with kids, but on top of that, he implements what's called sober parties. And I think this would be a huge, great asset to our county. And since I first started here in April of 2022, this is almost like an aha moment of like, yes, this is exactly what I've been hoping for and looking for, because we have such a problem with our teens and marijuana and alcohol use, which, as we know, leads up to more significant drugs, more serious drugs. And there's a generational cycle going on with parents and grandparents, and then we have the kids. So this sober party is something that I would start again to focus on some of our middle school age kids and really start to drive it home with them that you don't have to be under the influence or use drugs and alcohol to have fun. We can throw great parties without that being involved. And I think that's where we need to start in order to start to change this pattern.
Yes, please.
Do you have an AA program in the school?
We do not, that I'm aware of.
Would that be something to think about, to have meetings during school hours?
I do feel like, does Jess Bjork do
No.
any type of education or anything?
Not with that. And are you aware that we used to ever have any of that? AA or NA? Within the school, like for targeted at kids.
Sue Gardner, and you bring up Sue Gardner,
Mhm.
she ran an aftercare program for kids that did go to some type of treatment, and they had a group in the school.
Yeah.
It was called
Everything-
Alateen.
The biggest thing to change is we don't have the prevention.
Right.
Remember when we had the PEP program, we had the Boys and Girls Club, we put all that money out into LCO, to the PEP and Winter PEP, and we had the after-school sites.
Mhm.
Pat Sanchez ran all that. We have the one up in Hayward, the kids have places to go and they can hang out, it's all drug-free and everything.
And our community health assessment, definitely that had come out, that youth were seeking safe places to go have fun and connect with one another rather than the Walmart parking lot or other places. There just aren't places for kids to connect. It did work. So
Lakota Ray's Boys and Girls Club is very busy
very
after
busy,
school.
yes, which is great.
Extremely busy, which is great.
What I've heard a lot of the kids that I work with from the tribe say is there's not really, or it's their perception that there's not programming towards teenage kids that is something that they would be interested in.
Oh.
So,
So it works good for the middle school, the younger kids.
right.
Taking high-risk kids we were taking high-risk kids up to the boundary waters.
Mm-hmm.
We remember all that stuff?
Yep,
Groups of
yep.
kids?
I have a question, Joe, maybe you can remember.
You might
Those
need to get to a
prevention
mic.
programs were all grants, weren't they?
They were funded by grants. We had some county money in it, but it was
Yeah.
pretty much all grant. But the reality was we had a formula that worked really well.
Yeah.
I mean, we had targeted at-risk kids. I mentioned this before. I don't mean to front anybody off for kids but there were kids that changed that were part of that. Miriam Swart, Mimi, she's at Northlake. She's a provider for, a psychiatric prescriber. She was one of our PEP kids. So was, Dr. Tracy Kasamba was in our PEP center in Hayward here.
Mhm.
These kids did good. They got a lot of good things. It's just, we need money in that area.
Right.
Bill said he was a PEP kid.
Were you?
Weren't you?
Luann was,
Luann, I hired Luann. That
Yeah.
was good, wasn't it?
yeah, it was great.
Okay, thank you, Bill.
Yeah.
There we go.
Okay. Okay, folks.
Thank
Good
you,
discussion.
Sarah.
Let's move
Sarah.
on.
Okay, good discussion. Moving on to economic support update. Shauna is actually coaching a game tonight in Winter.
Okay.
So she has provided our report. I think the big thing is that they're still seeing a lot of calls coming into the call center. Their numbers are still looking really great, but still trying to process things. So from the consortium standpoint, they're able to offer overtime to staff to be able to work more hours so that we can get more people processed through more timely. So, and we do have 1 or 2 staff members locally that do take us take up that offer for adding additional hours. Again, that comes out of the consortium budgeting. Any questions on economic support? Okay. Hearing none, then public health is up as long as I'm still on the agenda, right? Yes, following it.
Hello, I'm Julie McCullum, Public Health, and I did submit a written report, but there was a couple of additions actually since this went to press, so I'll just fill you in on some new data. As of December 30th, all areas, all regions in Wisconsin were at high levels for influenza-like activity. We have received several respiratory hospitalization reports, not only just for RSV or influenza, but also COVID-19. So we're receiving all three actually. That is a new reporting request from Wisconsin as of November 1st. So this is the very first respiratory season where we're actually getting data on hospitalizations. And also, Dr. Malcolm alluded to this, but our vaccination numbers are a bit lower in Sawyer County than if you compared to Wisconsin as a whole. Additional data came out as of January 4th. Sawyer County was sitting at 14.3% of all residents receiving at least one of the updated COVID-19 vaccine. And the state average is 14.6%. And for influenza, we're a little bit higher, but still below the state average at 29.3%. The rest of my report is included in the written. Do you have any questions? Thank you.
Any future agenda items?
Yep, we have fiscal budget reports that are in there. I've already kind of spoken to that we're coming in within budget and looking really good there. Projections, even though we haven't closed out through the 2023, the projections are looking good for the budget year.
I'm sorry, I thought you had already gone over that, but
Yeah.
okay.
Otherwise, there, future agenda items.
Oh.
Anything anybody wants us to add or talk about?
Then we're adjourned.
Okay, thank you.
Thank you.